From the Toronto Star, I'm Adrian Cheung, and this matters. The Canada-US border is closed until October 21st. Both countries have continued to extend closures every 30 days since the start of the pandemic in March. Cases remain high here and abroad. The borders, in all likelihood, will remain closed until 2021 at the earliest. But when they do eventually reopen, what should it look like? There's a lot to consider in that question. We're talking about a mix of public health policies, epidemiology, the state of Canada's economy, and our relationship with other countries. Talk of reopening borders is happening. The Canadian government will begin letting in some international travelers with a focus on reuniting families and spouses.
Beginning on October 8, 2020, certain extended family members of Canadian citizens and permanent residents will be eligible to travel to and enter the country.
Immigration and Citizenship Minister Marco Mendicino unveiled a plan that will allow some family members, foreign nationals, and international students back to Canada. In an interconnected world, how do you reopen borders safely? What can Canada learn from other countries that have already started reopening? For some answers, we're talking to Dr. Vivek Goel, professor at the University of Toronto's Dalla School of Public Health and member of the federal government's COVID Immunity Task Force. Dr. Goel, thanks for making the time.
Great to be here.
So the border between the US and Canada remains closed, and it's hard to see any scenario where restrictions will be lifted until next year in terms of widespread border restrictions for Canada. And even in most public opinion polls as well, a majority of Canadians are in favor of keeping the borders closed for the time being. So in this time, what kinds of conversations is the federal government having about reopening the borders?
So I think first thing we have to think about is how long we're likely going to be in the situation we're in. And it is going to be at least another year or more before a successful vaccine is approved and then starts to get out and rolled into mass immunization campaigns globally. And just think of the fact that we would have to immunize around 6 billion people to start to get things back to the way they were. So that's not going to happen overnight. It's going to take time to manufacture all those vaccines and get them into people's arms. So we're going to be living with sort of what is referred to as the slow burn peaks and valleys of COVID as we're seeing right now. Things go up, things go down for some time to come. So then the next question is, how do we manage keeping people being able to travel? They have loved ones to see. We have international students coming in. People want to be able to go on a holiday at some point. So we do need to start to think about that. We wouldn't be doing any of those things when rates of community transmission are high in Canada, as we're seeing in many parts of the country right now. And we certainly don't want to be doing them with countries where rates of community transmission are high, like the United States or Brazil or India. But there will be times when rates come down low, as we had over the summer here in Ontario, and there'll be rates will be low in other countries. So then we think about how do we travel safely between countries where community transmission is controlled, but there's still some COVID going on. And so then the conversations that are taking place are, what are safe ways of reopening the borders between countries where community transmission is under relative control? One of the things that we have in place right now is a 14-day quarantine for all incoming travelers, except certain essential workers. Do we need to have a 14-day quarantine, or can we replace that with having some tests on arrival for people that come in and maybe they get tested again a few days later? So that's one of the things that's being looked at very actively. The second thing is, can we look at a way of having travelers do some form of risk assessment before they travel? And the risk assessment could look at the individual traveler. What are their risk factors for COVID? What are their risk factors for having acquired disease? What kind of work do they do? What country are they coming from? What region are they coming from? How much is the community transmission? And then what activities are they going to engage in when they come into the country? We don't want people coming in and going to big conferences, because that would be large events that would bring lots of people into mixing. But if someone's coming in for a business meeting for a few days and they can commit to minimizing the number of contacts that they're going to have, they're going to get tested, they're going to take private vehicles, they're not going to travel on buses or trains. So then those types of travelers are going to represent lower risk. So looking at the risk of the individual, where they're coming from and what they're going to be doing, we can start to think about in very strategic ways how we can get some travel re-going.
So the strategy being explored then is not so much a blanket ban across everything, but a case-by-case basis. We look at where the traveler is coming from, what our community transmission looks like. It's much more tailor-made for the situation rather than absolutely no travelers.
Yeah, and I think it's similar to what we're seeing right now in terms of our control measures, as opposed to back in March when we didn't know a lot about the virus and how it spread. Our complete lockdown was the tool that we had to take. And now we're looking at where are the sites of the most frequent outbreaks and transmission and saying, okay, can we control those sorts of things? It's the same thing on the border. Back in March, blanket ban on all countries, closed the land border with the United States. We've slowly opened up to a few groups, right? Family reunification, some international students, but largely we maintain a blanket ban. So I think going forward, because we're going to be in this potentially for several years, can we take that more nuanced approach and do that risk-based approach for individual travelers?
Do you find explaining the concept of reopening to the public, the how of how we reopen safely, do you find that part difficult? Because right now that discussion is still very binary of let's reopen or let's keep it closed. Do you find that discussion tough?
Yeah, I think people like to have things in binary or black and white, right? That it's certainty. And when you see what's going on south of the border, and when people think about opening up the borders, I think the other thing that you first go to is the reopening of the land border with the United States, right? Because we're so used to going across even for a day or two, right, to the United States. So we think about reopening the borders with the United States. I think, again, the more nuanced approach is thinking about what's happening in different countries and different places. And I don't think, certainly with what's going on currently in the United States, that the US would necessarily be one of the first places we would reopen with. We might look at countries in certain parts of Europe and Asia, the Caribbean, where there aren't a lot of cases going on. And, quite frankly, I think a lot of Canadians probably want to go to the Caribbean as the winter comes on. So we've had examples of travel bubbles, like the Atlantic provinces have their 4-province bubble. If things are under control here, and there's a few Caribbean islands that have things under control, and those islands obviously don't want people coming in and creating a lot of infection either, right? And so they've got protocols for safe entry, people staying in their hotels, or if they rent a house or something like that. But then when the Canadian returns, what are the precautions that they're going to have to take? Will they get tested when they come back? If they have to have a 14-day quarantine, can it be reduced with testing? But maybe they take some additional precautions. Don't go to restaurants and movie theaters for the first 2 weeks. So again, having more nuanced messages so we can start to have that kind of travel starting to come back with very specific sorts of advice. It is a very difficult communications challenge, as you noted, especially when we focus in on the headlines. So it's very hard to deliver these nuanced messages through sort of the traditional means of communications that people are looking at.
Yeah, and especially on this conversation, there is a lot of nuance given the complexities in all the different countries we have to communicate with.
Yeah.
The Public Health Agency of Canada says in the early days that strict border closures played a huge role in keeping the cases down. I think they said that imported cases dropped from around 3,800 to about 175 per month over the next several months in the early days. But now cases are quickly rising again, and it's pretty clear that it's via community transmission, right? If people from abroad mostly aren't being let in. What does this tell us about how useful border restrictions actually are?
So what it tells us is back in March and April, when we were still at our first wave at the uptake on it, at that time, most of the cases that were being picked up were in travelers, primarily coming from the United States and Europe. There's a lot of focus on China, but the major infusion into Canada was not cases coming from China. There was cases coming from Europe and the United States at a later stage. And at that stage, we were doing a lot of testing. Any international traveler or someone who had traveled in the last 14 days and had symptoms was getting tested. And so we were picking up a lot of those cases as well. And so the early closures that were done on the border, and we have to remember, it actually took several weeks, right, from when they announced, because we had a lot of Canadians abroad that had to come back in. So going well into April, what we were doing is we were picking up a lot of the cases in those international travelers, people that had come in before the border closures, and then the returning people that you continue to come in after the closures were announced. Once they stopped traveling, that dropped down. And at the same time, our community transmission was starting to increase. And so that's essentially continued to be the case. We now do have small numbers of cases in travelers because there is still international travel. People get picked up in their quarantine. So if someone has symptoms in their quarantine, they may get tested. And we don't actually have a lot of outbreaks that are related to international travelers because they're being asked to take precautions. So right now, as we look forward, again, as we're talking about, and we reopen borders with risk-based assessments, testing, and maybe continued quarantine for certain classes of travelers, what's going to be really important is to monitor how many cases are coming up out of those travelers. And if we start to see outbreaks related to them, obviously we would have to think carefully about the level of containment measures that are being taken. But based on the current data and the experience of other countries that have done this, so we have a number of countries, Iceland, Taiwan, that have opened up to travelers in select cases with these kinds of testing regimes. They've not had outbreaks related to the travelers. And so there's lots of experience that we can take from that.
So I actually wanted to get into some of that research too, because you're part of the federal government's COVID task force. What kinds of research are you working on, especially when it comes to travelers and tracking how many cases are coming in, what time people start developing symptoms? What's being learned there?
So this work is actually not part of the task force. This is work that I'm doing as a professor at the university with some colleagues at McMaster, is working with Pearson Airport and Air Canada on looking at exactly the question you just laid out, is in returning international travelers who are going to go into their 14-day quarantine, which is currently mandated by the government, we are offering them testing on arrival, day 7 and day 14 of their quarantine. And with that, we're going to generate data that will see, okay, how many of these travelers actually are carrying the virus? How many of them get picked up on the arrival test? How many get picked up on the day 7 test? And our expectation is most people are going to be negative on the day 14 test, right? Or they will not get disease while they're in quarantine. But we're going through those 3 steps. So that, and we're also looking with that on evaluating the feasibility of doing testing at the airport as people arrive. We're using a home testing kit where people do a swab on their own of their cheeks and their nose. It gets sent into the lab and they get the result back. So we're not only looking at getting the data on what these rates are in travelers and what the alternate strategies could be, but also the feasibility of having this kind of program. So if the government does choose to implement them, they'll have some information around how it could work at airports across the country.
And we are seeing some of those tests happen in some parts of the world. I know, for instance, in Hong Kong, there's rigorous testing before anybody can step out of the airport. So that is being done on some level already.
Hong Kong has been doing this since March. For every traveler that comes in, I think originally they had to wait until the test result at the airport, and they couldn't go back out. There was a piece earlier this week about the Rome airport has a testing program in place. They were using both one of these new rapid tests as well as the swab and offering people the choice of the 2. So there's all sorts of different approaches to this. We're looking at what's known as arrival testing, so getting at people as they come in. There's also people looking at departure testing. And in terms of interprovincial travel, we may want to do both. Test people before they get on the plane and then test them maybe a few days after they get off. So there's all sorts of approaches. I would add on this, though, the key issue is we're going to need massive testing capacity if we want to restore travel with these sorts of strategies.
Right, because I was going to ask, what are the big public health marks that we need to meet? Is it tons of testing? Is it quarantine measures? Is it low community transmission? What are the marks that we need to see before we even really have this conversation in widespread way?
So it's all of the above. Everyone hopes for one thing that's going to solve it all, but it's a combination of things. So one is we have to have community transmission under control before we entertain this, right? Because if we don't have capacity to do contact tracing and manage people if they're sick in our hospitals, then we certainly don't want to start admitting more international travelers, right? So we have to have community transmission under control, and the countries that people are coming from have to have community transmission under control. Once you have that, we have to have adequate testing and contact tracing for everyone, both our own people and any travelers that come in. So if we go back to January, when we were having the first cases coming in from Wuhan province, right, in China, we did a great job in Canada. We would diagnose those cases quickly, would find out who their contacts were, put them into isolation. We never had community transmission as a result of a traveler coming from China. And when people talk about we should have closed borders earlier to China, and we saw that, continue to see that being debated in the United States. That was never the issue, right? Because it was already transmitting in Europe, in Iran, in a whole bunch of countries. And border closures at that stage would not have been the solution. It was being able to test and detect cases and find who all their contacts are. So as we look forward, that's a very critical marker for public health. We have to continue to build our testing capacity, both with these new tests that are coming online, like these rapid tests that have just been approved. There'll be more antigen tests and so on that will be done quickly, but as well as the confirmatory testing, the viral testing that is done through our public health system, through the assessment centers. Because even with the rapid tests, we're going to need confirmatory testing. So we need to continue to invest in all that capacity. We need the contact tracers in public health. So when someone does test positive, we have to be able to get to them really fast, find out where they were, who their contacts were, and get to those contacts. Unfortunately, right now, in some parts of Ontario, it's taking several days for someone to get a result. They may have to line up to get tested, and then they have to wait to get the result. It takes several more days for the contact tracer to get a hold of that person, and it then takes a few more days to reach all those contacts. So you could have almost a week go by, right? And how many more cases get infected before you actually contain that? All of that has to be able to happen in a relatively short period of time in order for us to control things. And then we need to continue to make sure our health system capacity is in place, that we're not overwhelming our hospitals, our intensive care units, because if that's when we start to see the increase in deaths, is when we have the healthcare system being overwhelmed. So unfortunately, it's not just, here's the one thing we have to do. We have to make sure right across the spectrum, we have all those resources in place.
As with so much of this pandemic, there really is no silver bullet that solves everything. It's a combination of many things we have to do well.
Yeah, and it's the same with the vaccine, right? There's a great hope that the vaccine is going to be a silver bullet. It's going to come quickly and it's going to solve everything. And, I do expect that we will have vaccines starting to get approved for use in the US and Canada and the EU, maybe as early as sometime later this year, but more likely in sometime in 2021. But there'll be early vaccines. They'll still have a lot of work to be done. They may work for some people. They may not work for everyone. They may have side effects in certain populations with certain pre-existing conditions. So that's why it's important that we focus on multiple vaccines. And to really bring things under control, we'll probably have 3 or 4 different vaccines, and also just manufacturing capacity for all of those. That's going to take longer, and it's going to take time to get all of those manufactured and rolled out. But even when we have a vaccine, if we get 70% coverage, COVID will not likely be eradicated. It'll be with us, right? And so that's why the vaccine itself is not going to be a silver bullet. We're going to have other control measures, detection of COVID, contact tracing, and so on, just like we have for a lot of other infectious diseases. So we have vaccines for measles, but we do have measles outbreaks from time to time, right? And we look for them, we detect them, and so on. My expectation is COVID-19 is going to enter into that category of disease. We may be lucky, we may be able to eradicate it completely, but that will take a lot of work, and it's not going to come from the vaccine alone. It's going to come from a lot of these other measures being in place.
We'll be right back. I wanted to loop back for a moment to how we discussed what other countries are doing, because some areas in the world have gradually reopened and have proven that they can do it at scale, depending on, again, testing and quarantining. What lessons can public health here in Canada learn from other places? I mean, the EU, for instance, has notably reopened.
Europe's efforts to navigate this pandemic, border controls have been lifted after 3 months of them being closed. And of course, the hope is that this is come in time to allow the summer holiday season to help kickstart economies across Europe.
There's a patchwork of ideas there, but what lessons can we learn from what other places are doing?
So some parts of the EU, Germany, the Scandinavian countries have done quite well. And other parts, France and Spain, they're going back up again. So we can learn from both sets of experiences, right? What has worked and what has not worked. So first of all, we have to have really good surveillance, the information systems, the testing capacity, and be able to respond quickly when people are symptomatic. We have to have testing in places where people have a lot of exposure, testing for school kids, people that were working in industries or sectors where they get a lot of exposure to the public. So certainly scaling up testing capacity is critical. Contact tracing, those countries have really good systems for contact tracing. They've deployed apps for contact tracing or exposure notification. We have the COVID Alert app in Canada. I think we're at about 3 million downloads. We have to increase that massively if it's actually going to have value in doing the exposure notifications. So we can look to these other countries where they've been successful in those sorts of things. I think there's a cultural thing, and I think Canadians are more like some of those countries than, say, people in the United States, is, following the guidance that comes from governments, following the regulations, right? And where we're seeing our really big outbreaks, and like you can see our leaders are getting frustrated with this, is where people are just not following some basic guidance, right? So having large gatherings in indoor places with people mixing without paying attention to the guidance of keeping separate, that's leading to outbreaks. And so, the countries that are doing well, I think, have cultures where they tend to follow the government instructions and they tend to respect each other.
It's clear that a full reopening is a long time away from happening, potentially a full year from now, as you mentioned at the beginning of this conversation. And perhaps this is speculation, but when do you think Canada can start thinking about gradual reopening?
So there's a couple of things. One is all the control measures that we talked about. We really make sure we have really good testing, contact tracing capacity, because when we're able to do that, and if community transmission is low, we can prevent big outbreaks from happening, right? So if we don't have that in place, we're not going to be able to get things reopened. But the second aspect of it that I think is really important is we need to recognize that there is going to be COVID transmission. And we need to recognize who we need to protect. We need to protect the more vulnerable populations that are at higher risk of being hospitalized, having severe disease, and unfortunately death. The older populations living in congregate living settings like long-term care homes, shelters, people with pre-existing health conditions that put them at risk, right? And recognize that we will have some cases in other people, but as long as we have adequate health resources, contact tracing, everything in place, we learn to live with it. So it's more than just, will we have everything in place? We also have to think about the attitudinal change that we have to deal with the fear that is built up about COVID-19. And it really involves making sure people understand the balance that exists, because an indefinite shutdown, even partial shutdown, which is essentially where we're at right now, has very significant health consequences, right? If people aren't able to work, they can't get food. They have other health consequences that will result. If kids aren't able to go to school, there are very long-term health consequences for those kids. If we have to shut down our health system again, if people are afraid to go to the emergency room when they're having a heart attack, which we have now documented evidence that that is happening, that has health consequences. So that's what I mean by the sort of the attitudinal change, is that we have to start thinking about this from a very broad population health aspect. There are risks with COVID, but there are also risks with the public health measures. It's not economy versus health. It's all about health.
Dr. Goel, thank you for making the time to talk.
Thank you.
That's Dr. Vivek Goel, professor at the University of Toronto's Dalla School of Public Health and member of Canada's COVID Immunity Task Force. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.